So again, this is our Intro to Health Professions workshop. We're going to go over quite a lot today. Again, so feel free to raise a hand or on Zoom or in person if you have a question. But we will have time for questions at the end as well. Okay. There we go. So quickly, just to start, everyone in person, I know Charlie was just saying you've got a little handout that is our workshops and events for this fall quarter. Here it is online for you people on Zoom too. You can also get this on our website as well. But we've got a lot of great workshops coming up this quarter. So please feel free to come by. Again, we're going to have pretty much all of these are going to be hybrid, both in person and on Zoom, except a couple, the Graduate Law School Professional Fair, that is going to be in person only, as well as the, I think they're, Charlie, do you know if you use your early insurance program, is that going to be hybrid?
That is going to be just on Zoom.
That's just on Zoom.
Just on Zoom, yeah.
Oh, I see. We know that there. Yeah. Okay, great. So yeah, feel free to come by. But so let's get started with basic question. What is pre-health? Well, pre-health and pre-med is not necessarily a major here. There are some universities where you might have like a pre-med option or something like that. But really, when we're talking about being a pre-health, pre-med student, it's not really referring to the major. Basically, it's just referring to students that are seeking admission to some sort of health profession program after completing their bachelor's degree. It also can mean just a student who's embarking on a specific course of study, getting that experience to help prepare them for those professional school programs and being a well-rounded applicant. But again, it's not necessarily any specific major. We'll go into this a little bit, but we have people who are pre-health who are CNAS majors. They studied sciences. We got people from CHAS. Really, it can be any major you want. What really matters is taking the necessary prerequisite courses. And again, we'll get into that in a little bit. So just broadly speaking, these are some popular health career tracks. This is not an exhaustive list by any means. There are tons of different programs that you can go into. Here's just a couple that we're going to highlight real quick. Some of these are probably going to be familiar to you, but there are actually well over 120 different health professions. Some of them that you probably know about, some that you might not have heard about before. So we really encourage all of you to really explore different health career options. I know a lot of you might be pre-med, pre-dental, and that's great. We totally support you in doing that. But one thing we also want you to do is look at what other options are there. Have you considered being a PA, for example? Have you considered being a genetic counselor? Like there are so many great career paths that you might not be aware of. So please feel free to come by, even if it's just to help explore what you want to do. One thing that can also help with that is a great website that we recommend a lot called explorehealthcareers.org. It's a great website you can go through. You can actually filter through a different kind of ways. You can filter by how many years of school you're willing to do, salary outcomes. You can sort by different categories of healthcare. It's a great website to kind of do a little bit of that exploration yourself too. Generally speaking, though, when we're talking about going into a healthcare career, there are some things that you kind of want to ask yourself to decide if it is the right path for you. So one is, do you excel in your science and math courses? That's something you're going to want to know because you're going to have to be taking quite a bit of them. And certainly when you get into your programs, they're also going to be very science and math based as well. So you should have at least some sort of liking for the sciences. Also being a good test taker. That's an important thing too, both for getting into programs and then during those programs as well. So being a good test taker is important. When we're talking about big admissions tests like the MCAT, ECAT, stuff like that. You also want to think about what is the scope of practice that you want to have with patients. What is the way that you want to interact with them in your career? Do you really want to be a very hands-on type of person? Do you want to be someone that's more like a supportive role? Like what kind of patient interaction do you want? Because there's a lot of difference. If you think about what does a medical doctor do versus what do the pharmacists do? And how do they interact with those patients? When do they see them in the whole healthcare process? Those are some things that you might want to consider as well. Also, what is your scope of practice in terms of what you can do? Are you prescribing medication? Is that an option that you want to be able to do within your career? Do you enjoy working with people? Across the board, healthcare careers, for the most part, unless we're talking about more of like the laboratory science stuff, you're really working directly with people. So having those social skills, wanting to work with people and enjoying that is something that's going to be very vital for a lot of these health professions, as well as working under pressure. a lot of times when you're meeting with these people, it's not always under the best circumstances. A lot of times you're seeing people who are in really one of the lowest points of their life and they have some, sort of medical emergency or problem. So, working well under pressure is something that you want to consider for a lot of these careers as well. And that can vary from career to career. Again, if we talk about, say pharmacy and being a doctor, sometimes the difference in how you're interacting with patients is really different. If you're seeing them in an emergency room versus just, a checkup or at the dentist or, working at a pharmacy, there's a lot of differences with these health professions. So that's also something you want to consider is what kind of pressure do you think is going to be right for you in your career? Also, related to that, would you rack working with the sick or terminally ill? Is that something that you'd be comfortable with being able to do? How long are you prepared to be in school? That's a big one too. You're thinking you've got 4 years of undergrad, and then you've got your program, the professional school, and that can be very long, especially if you're talking about certain tracks. Psychiatry is one of the longest ones. When we're talking about 4 years for your bachelor's degree, then you've got med school, then residency, and then specialized training. It could wind up being like a total of about 12 years of school. So it's a lot. You better enjoy school because you're going to be doing a lot of it. And there are different varying lengths in terms of different healthcare professions. They're not all that long. So another thing to consider. What are your expectations for a work-life balance? Again, there's differences between these different careers. A lot of times you might be on call. I mean, people need healthcare services at any hour of the day, right? But then there are some other professions where you're working more of the, 8 to 5. You're working as a physical therapist or as a dentist. You might have a little bit more closer to Monday through Friday, 8 to 5 kind of hours. So it kind of depends on what career you're going into. But yeah, that work-life balance is very important too. Or are you going to be able to have what you are looking for in your career with these different health professions? These are all really important things to think about. And again, things that you can come in, talk with us about, and we can kind of help you do that exploration as well. So now we're going to look at a little bit of national data. This is from 2021 for admissions for different programs. A lot of different programs will have a centralized application service, and then they can basically gather that data and report it so we get to know that sort of stuff. And with all of this, it's really important to take this with a grain of salt and realize that when we're talking about these averages, they're averages. Doesn't mean, okay, if you don't have exactly a 3.7, you're just not going to get in. There are people above that, there are people below that. When we're talking about getting admitted into a lot of these schools, it's more than just these numbers. They really look at you holistically in terms of your whole application, not just your grades, although those are very important, but also they want to look at what did you do for your activities? Did you do research? They want to look at your personal statement, letters of recommendation. There's so much that goes into it. Nonetheless, though, the academic components are very important. So GPA for overall, science GPA, and then a lot of times admissions tests as well. So if we look at this top row here, this is for allopathic medicine programs. These are MD programs. You can see that there are a lot of people that applied, 62,000 in 2021. And then we look at matriculants. So we're looking at people that actually do get in and go into medical school. The percentage is pretty competitive. It's about 36% for this last year cycle. And that's across about 141 programs. And you look at the cumulative GPA and then also the science GPA, because that's a very important way that a lot of these professional programs will look at you. It's not just how do you do overall, but how do you do in your science courses as well. So we can see an average of about 3.7, and then science a little lower, about a high 3.6. And then you also have the standardized test, which for ND programs would be the MCAT. And we see a 511 was the average there. Again, take this with a grain of salt. This is a national average. So medical schools are going to differ. One school is going to have a different average GPA and MCAT than another one. So it's not, again, just if you don't have exactly this, you don't have a chance of getting in. This is kind of more ballpark stuff. But again, you can look through some of these other ones and see that, they're all really competitive, right? And, a lot of people look at MD programs as being the most competitive, but sometimes other ones are actually a little bit more competitive. Sometimes PA schools actually can have a lower acceptance rate overall. So suffice to say that these are all competitive programs. And again, academics are going to be very important. So make sure that if you are a pre-health student that you are really focusing on doing well academically. I always tell students that when you're a student here, that's the time to focus on your grades. You want to be doing extracurricular activities as well, but not to the detriment of your academics. Because if you don't do well academically, well, it's going to be really hard to get into these programs. And you can always do more stuff afterwards, but the grades, this is your time to do it, right? Anyway, so national data in terms of averages and stuff. Again, when it comes to actually applying to med school, it's really good to do research in individual schools as well. But enough of that. We have a couple things in the chat. Let me check that real quick. Oh, someone was just asking, yes, this is being recorded and we are going to post this on our YouTube page. That's a good time for me to actually plug that we have pretty much all our workshops that we've done in the past are all on our YouTube page. So you can feel free to check those out. And we're going to try and do the same for all of our current ones for the fall. We have a great library of videos on there now for you all to watch. I definitely recommend doing that. Again, going back to the major now. When we talk about being a pre-health major, you don't have to be any specific one. If you look at this breakdown that we have here, again, this is from MD application data, you can see that biological sciences is the dominant share of this. Makes sense. But you'll see that almost half of it also comes from other majors. Well, we've got humanities represented, math and physical sciences, social sciences, almost 1 in 10 MD students are from social science. Again, the major doesn't matter so much. You do need to take the prerequisite science courses and obviously do very well in those. But if you have a certain passion area, you can do that. Again, I'll go back to the example of being a psychiatrist. A lot of psychiatrists will actually do a psychology major. Kind of makes sense, right? Again, you can do that. You need to find a way to then also take the science courses if you're, say, a CHAS major in the social sciences. But again, you can meet with us and your academic advisor. We can help to figure out how to fit in those prerequisite courses, because that's ultimately the thing you need. It's not a bio degree, it's the prerequisite courses, and doing well in those is what you need. Okay, let's see. Oops. There we go. So about those prerequisite courses. This is going to be one thing that is going to vary slightly between different professions, and even then it'll also vary slightly between individual schools. So one thing to note is that we're going to give you kind of a general outlook of what you need for prerequisite courses, but you definitely want to check with specific schools in terms of what they require. For the most part, they're pretty similar, but you definitely want to make sure that if one school says, hey, we really want you to take a psychology class, that you make sure you do that if that's one of the schools you really want to go to. But generally speaking, and this is for most health professions, we're talking about med, dental, pharmacy, vet, physical therapy, and optometry. These are kind of going to be the general core requirements. So a year of college English, a year of college math with 2 quarters of calculus and usually 1 quarter of statistics. Math 1 can vary a little bit depending on the program we're looking at. That's generally what we're talking about. And then the big ones are really going to be a year of the basic science sequence courses. And when I say sequenced, I mean that these are, at least at UCR, going to be 3 quarters long courses. So it's going to be bio, A, B, and C, basically. And all these are generally going to have lab classes with them as well. So these ones are going to be general chemistry, general biology, organic chemistry, and general physics. Again, all with lab courses. And here at UCR, being a quarter system school, it's going to be 3 quarters to do one of these year-long sequences. Additionally, you might also see some additional requirements or usually more recommended courses for med school. It's going to be great preparation. Biochemistry is a big one for most people. If you're going to go into like dental or pre-med, you really want to do a biochemistry, at least 1 quarter. Anatomy and physiology, weirdly enough, not required for medical school programs. I know that's a weird one, but thing is, when you get to med school, you're going to learn anatomy and physiology very in depth. So you can definitely take that one. It can be recommended sometimes to take it before going to med school, but it's not actually going to be required. However, for some other programs, nursing, PA schools, some other ones like that, it can be required. So just take note based on what you're looking into if you do need it or not. Other recommended courses, microbiology, genetics, a lot of social science classes. Again, we're talking towards the beginning that you want to be able to work with people well. So knowing how to work with people, taking those psychology, sociology classes, those are really important too. And not just for your career, but also for more immediate concerns. The MCAT, if you're pre-med, has a big section on it that's going over more of the psychology and sociology based stuff too. So it's definitely recommended to take some of those classes. Again, when it comes to specific schools, you do want to check to make sure you've got the right courses. I definitely recommend meeting again with one of our counselors with HVAC to kind of go over what you have, make sure you take the right courses, and then work in conjunction with your academic advisor to really make sure that those fit in with your core plan for your actual major as well. And for some, it's easier than others. If you're a bio major, a lot of these courses, it's already included in your major. But if we're talking about some other one, then you really want to make sure that you're fitting in these courses the right way, so you're not holding yourself back at graduation, but you're also taking care of these prerequisites on time. Okay, so some important notes about academics when we're talking about these classes. AP credit, that's one we'll start with. I know a lot of you come in with those AP credits, but some things to know is that not all schools will have a policy where they accept those AP courses. So you definitely want to check to make sure whether or not they will. Generally speaking, when it comes to like the math, with the calculus and statistics, it's probably a good idea to continue on with the math anyways. Some schools will accept that math credit, some won't. You definitely want to check. English, if you got credit for English 1A and 1B, you'll still likely want to take 1C, and then to get that full year of math, take some additional ones, basically just other classes from the English department. Could be literature, could be writing. Health professions prerequisites, and this is a really big one. They need to be passed with a C or higher. And that's important to note because at UCR, you can pass these courses with a C- in UCR's eyes, but when it comes to pre-med schools or any other health profession programs, they need a C or better to be counted as passing. That can be an issue sometimes because if you get a C- in say chemistry, UCR will say, hey, you passed, you can continue onwards. But for pre-med or pre-dental, you're going to need to take that class again. This can be a little bit of an issue though, because UCR usually won't let you retake a class because you passed it. So if that happens, you definitely want to work with our advisors here to figure out how you can retake that class, either at another school or somewhere else. But suffice it to say that you really want to make sure that you're passing your classes with a C or better the first time you take them, and hopefully better than that too, because again, we know these schools are really competitive. And with that, please make sure that you are using your resources. We have tutoring, we have supplemental instruction, your advisors, your professor's office hours. Make sure that you're doing what you need to do to be successful in these classes. Because one thing, we'll actually skip down one bullet point, is that when you repeat a class, both grades are counted in your transcript and your calculation for your GPA for professional school programs. So if you get that C- in a class and you retake it and you get an A this time, great, that's good. You need to do that. So that's awesome that you did that. But what's going to happen is those are just going to be calculated as essentially two separate classes. They don't average the grades together and make it just one class's worth of units. It doesn't replace the old one. Even if your school has a policy where they say they replace grades, when it comes to applying to professional schools, they're going to calculate everything that you've done at the college level. So that's really important to make sure you're doing well in these classes. Utilize your resources. And I'll go back to the one I skipped. So all health professional prerequisites should be taken for a letter grade. That's a little less common nowadays. We're kind of getting out of the COVID era policies with that. But basically, if you have a class that is a prerequisite, you want to make sure that it is taken for a letter grade and not credit no credit. Let's see where to leave off. Science GPA. So when we looked at the average statistics for these different professional school programs, you saw that there is the cumulative GPA and then also science GPA. And that science GPA is really important for a lot of these programs. When they calculate it, it'll depend a little bit on terms of like what profession you're going into, but I'll use MD as an example. They use what's called the BCPM GPA, which is going to be bio, chem, physics, and math. And those classes that fall under those subject matters are going to make up your science GPA. It's going to include everything you've done, whether it's a prerequisite or not. If it's a biochem, math, physics, or math class, it'll be calculated in that science GPA. So lower division, upper division, whether it's required or not, whether you pass it or you fail it or you repeat it, all that gets calculated. When it comes to calculating your science GPA, unfortunately, when you go into RWeb, it doesn't do that for you, not in the way that you need to do it. So one thing that we have on our HPAC website, actually I'll take a second to show you real quick this why not? It's a good thing to look at. If you look at UCR HPAC, search us up on the web. This is our website that we have. Really great resources on here. Please check it out. But one thing I wanted to show you was, again, calculating science GPA. You go down here to see where it says preparing to apply, and scroll down a little bit. We have this full section on how to help calculate your science GPA. And we actually have a link down here to a calculator that you can download. It works in Excel. And from what I've heard, it only works in Excel on the desktop version. So you'll definitely want to use that. There's some other calculators online you can get to if you don't have Excel. But you can use this calculator to help calculate what your science GPA is. Because again, you won't be able to see that just normally in our web. Also, we have some quick sheets on how to calculate the science GPA for individual programs. Again, when we're talking about MD programs through AMCAS as the application service, it's going to be just these ones in this orange box: bio, chem, physics, and math. Some other science courses might not be calculated in there. So you can see agriculture or computer science. They're science, but they're not going to be calculated in science for terms of medical school admissions.
And these are just really quickly, these are really great resources that you can bookmark. For the calculator, I know a lot of students will take classes during the summer on a semester calendar, and of course work quarter calendar. So one of the cool things about that GPA calculator, it will allow you to combine semester and quarter courses, and you don't have to do anything but put them in and click that it's semester or quarter. So super easy,
Yeah.
and free.
Yeah, hopefully everyone heard that in the room too. We have mics in the room, so hopefully that came through. But yeah, you can basically, using that calculator, you can do quarter or semester, and it'll help do that conversion for you if you took like a semester class at another school, which is super nice. Because quarter and semester units are not the same. So yeah. Here's a quick screenshot of how that calculator looks. Again, you can see you can enter in your transcript grades, how many credits they were worth, check whether they are a bio, chem, physics, or math, and then if it's quarter or semester based, and it'll do all those calculations for you. It'll tell you your cumulative and then your science GPA. I believe it'll also break it down by year too, so you can see that as well. Okay, and then student organizations. So getting involved in campus is going to be really great for your own benefit of learning more about getting into professional programs, but also it really can look good for just your application for professional school programs. Although I will say it is going to be a lot more beneficial to be an involved, active member of a club than just being a member. So if you just sign up for the AMSA, the American Medical Student Association, cool, that's nice, but what's really going to look at is, what did you do with them? Did you volunteer for different positions? Did you have a leadership position? Were you involved in events that they put on together? Those are the kind of things that are really going to be the value. But regardless, just being a part of these institutions, these clubs can be really great because they have a lot of great information, a lot of support from other students. So here's just a few of them. These are just 6, but we have like, do you remember the number, Charlie? It's like 100. It's something crazy like that.
There's like 300 clubs and orgs, and I think about 50 of them are free help.
Yeah, specifically 50 are just free help broadly focused, and then there's so many more that aren't free help, just other clubs as well. So please take a look. You can actually go to highlanderlink.ucr.edu, and you can take a look at all the clubs that we have on campus. And you know what? If there's a club that we don't have, you could start one too. And think about how that would look on a medical school application. That's super involved. If you take the initiative to do that, you take the leadership to make your own club, that looks great, right? So yeah, please get involved in clubs. We've got one for basically every pre-vet, pre-dental, pre-whatever we have. Clinical experience and shadowing, that's another great kind of experience that you can get to prepare yourself for these professional school programs. Broadly, volunteer hospital, volunteering at a hospital, basically. There's a lot of opportunities to do that. Hospitals really can use that help. We have listed a couple on here that you can look through. We also have on our website, again, a great list of opportunities that you can go for. Generally speaking, when it comes to these sorts of volunteer experiences, you want to look for stuff that really gets you interacting with either patients primarily or with like the hospital staff. If you're doing some sort of volunteer work where you're just filing, that's not going to be really helpful or beneficial for your application. So look for the things that get you that sort of patient interaction. Working in nursing homes or hospice care facilities, independent like retail pharmacies, dental offices, optometry offices, outpatient physical therapy offices as well. All great things that you can do for volunteering, but then also shadowing. Shadowing is broadly just following around a professional in their work, asking them questions, getting to see what they do, and that's really beneficial. One of the reasons for that, it's really twofold. One, for yourself to figure out, okay, is this the right career for me? If I, see what a doctor does and I don't like it, well, that's a pretty good indication that it might not be the right career for you. But then two, it's also great for medical schools and other professional school programs if they want to know that you've done that for yourself. They want to know that you've explored and confirmed whether it's the right career field for you. So shadowing can be really valuable for those reasons. Oh, so we have a couple more chats. Okay, so one about MCAT. So we can go a little bit on MCAT, but I'll answer really briefly. When it comes to MCAT, you want to take it when you're ready for it. But essentially, you want to take it before you apply. You want to have your scores ready to go. But in terms of exactly when you want to take it, it's really going to depend on your sort of specific timeline. So I really encourage you to come in and make an appointment with us. We can go over specifically what's going to work the best for you. But for most students, it's going to wind up being like the winter, early spring before you apply, generally speaking, but it's really going to be what works best for you. Okay, so moving on. What we do at HVAC, we offer a lot of different services for pre-professional programs. So we are basically the official pre-health advising center on campus, so feel free to come see us. We do assistance for the whole application process, so from exploring health careers to make sure it's right for you, to preparing for the application, to personal statement reviews, interview preparation. We do all that stuff, and we see students even after you graduate as well. So feel free to come back after you graduate. We do individual or small group advising for all health professions. Again, we listed all 120 plus of them. We do all of those. We do workshops like this one. We have our weekly electronic newsletter that you can sign up for on our website. We have our social media where we post updates. We also have our YouTube, which I mentioned earlier, which has the recordings of all our previous workshops. We also have our Ask an Ambassador program, which we'll talk about on the next slide. And we also have a 24/7 chat bot that's on our website that you can utilize for questions as well. So our ambassador program that I mentioned, we have a great group of ambassadors who are upper division students in different pre-health options, and they are available for you to come in for drop-in hours and to ask questions. And they're really a wonderful resource because they are current students who are doing these things. So if you have a question about, hey, I heard about co-health scholars, is that a good thing to get involved with? What is that kind of like? Well, you could ask a student who's doing it currently or just recently done it. So the great sort of service that we have for you all to use. No appointment needed, it's drop-in hours, it's Monday through Friday. We have both in-person and virtual appointments. Sorry, not appointments, drop-in hours. And that's all on our website as well for the schedule. It's not a commitment. You can stop in once or you can come regularly, up to you. And again, our schedule is online. One of the last things I want to go over before I turn it over to our guest is we just wanted to go over a little bit of the timeline. When it comes to a lot of these professional school programs that will have a primary and secondary application process, generally speaking, that's going to be your medical, dental, pharmacy, physical therapy, those sorts of ones that will have a two-step process. The timeline is generally going to be pretty long for the application. It's usually going to be that you're applying about a year in advance of when you actually want to start your program. So if we're talking about, say, medical programs, in your third year, if you're applying on this top line here, right in the beginning of the summer, we're talking about May, June, around that time, that would be to then start the fall 1 year later. It's not to start this next coming fall right here in your fourth year. It's a whole year in advance. So if you wanted to go straight into medical school after doing 4 years of a bachelor's degree, you would be applying the summer between your third and fourth year. Now, you don't have to do that. A lot of students elect to do a gap or implied year is what we'll call it. That can be really beneficial sometimes because instead of doing the whole application and interview process during your fourth year, you can apply after you graduate and be doing that in a year after you graduate, where you can really just focus on the application, focus on continuing to get more, community service and volunteer hours, and that can be really beneficial for you as well. So another thing that you can come talk with one of our advisors about, figure out what's going to be the right plan for you specifically. Because this isn't something that medical schools really will dive into and really care about too much. They want to really admit students that are prepared. And that's totally dependent on you and how long that sort of takes to happen. They don't, penalize you for taking longer. They just want to make sure that you're ready when you get there. And then lastly, contact information for HPAC right here. We have our social media, our website's a great resource. Please contact us. And hopefully it didn't take too much time. Yeah, okay.